In the aftermath of the Cold War, in a nation overcome by fear, one man had a solution to a problem that didn't exist. Born out of the fear of a national food shortage, the Farm Bill encouraged high-volume food production rather than the good old standby of supply and demand. Through large government subsidies, farmers and ranchers were rewarded for producing more food in less time using less space. The use of antibiotics in animal feed became a popular method of preventing illness from being spread in crowded animal conditions. They also found that it rapidly increased animal growth, which meant animals were ready to harvest sooner. Bacteria that are harmful to people live and thrive for generations in animals. Over time, these bacteria become resistant to the antibiotics in animal feed, and therefore the strongest bacteria strains that cause human illness become resistant to typical antibiotic medications. Humans come in contact with these resistant bacteria by eating products from these farms as well as by working on the farms themselves. People with suppressed immune systems, such as the very young, very old, and the sick, are disproportionately impacted by this problem. Antibiotic resistance has led to over 2 million illnesses and over 23,000 deaths every year, carrying a price tag of nearly $20 billion a year in healthcare cost and $35 billion in lost productivity. What can you, and that guy over there do about it? Well, you can put your money where your mouth is and stop supporting the concentrated animal feeding operations by voting with your dollars. This means buying meat without the use of antibiotics, buying local, and eating less meat. The average American eats twice as much protein through meat consumption as they need. You can also contact your federal representatives and demand an end to the government support of concentrated animal feeding operations, which artificially lower the price of conventionally raised meat. With your help, we can reduce the non-medical use of antibiotics so that they will work for you when you really need them.